Hello, my name's Dr. Ravi Ramessur and I'm a consultant dermatologist and postdoctoral research fellow specialising in psoriasis, and I'm speaking to you today as a spokesman for the British Skin Foundation. I have the privilege of sharing with you why psoriasis research matters and what the BSF has made possible through public support, and why that support is so important for people living with psoriasis and for the researchers working to improve their care. Psoriasis affects about 1 in 50 people. It's lifelong, it's very visible and often misunderstood. For people with psoriasis, it's not only about red or scaly skin. It can affect joints, increase the risk of heart disease, impact mental health, and influence how people feel about their bodies, their confidence, their everyday lives. Everything we understand about psoriasis and every effective treatment available today exists because of research. Over the past 3 decades, the British Skin Foundation has funded over 50 research projects investing over £2 million with no statutory funding. What's remarkable is the variety of research. The BSF has supported studies asking very practical questions like why some treatments stop working, why some people develop arthritis and others don't, and how lifestyle factors such as weight and diet influence psoriasis severity. Some BSF projects have helped refine how light therapy is delivered so it works better and more safely, and others have improved how we score and track psoriasis severity, which directly affects treatment decisions. Other projects have explored why psoriasis is linked to conditions such as obesity, diabetes, and heart disease, and they help doctors think about the whole person, not just the skin. There's also been important work looking at the emotional and psychological impact of psoriasis, helping to ensure that mental health is recognised as part of routine care, not just an afterthought. This research helps close real gaps in care, gaps that patients experience every day. Why does one treatment work brilliantly for one person and another doesn't? Like, why does psoriasis flare at certain times? And how can we deliver care that fits better with people's lives? This work matters personally to me. About 6 years ago, early in my academic career, I received a BSF funding grant before I started my PhD. The early support allowed me to develop a research idea, collect data, and ultimately complete a PhD focused on psoriasis. It laid the foundation for everything that followed. My careers spanned across continents, including collaborations with the International Psoriasis Council and a postdoctoral research fellowship in the United States, across sectors of academia, from direct patient care to guideline development and regulation. From a researcher's perspective, BSF funding is often the first belief in an idea. It helps researchers have confidence and evidence to go on and secure much larger grants. For people living with psoriasis, the research really translates to real change. More treatment options, better informed decisions, fewer side effects, and recognition that psoriasis affects both physical and mental health. Patients may never see research itself, but it impacts them every time they sit in clinic and they realise that they're better understood and better supported. Public support doesn't just fund research, it turns unanswered questions into better lives for people with psoriasis. Thank you to the BSF for making that possible.